Enjoy with your headphones for a better listening experience.
Please watch till the end of the video to have the most scariest part of the story.
What medical malpractice horror story do you know? My grandmother went in for a procedure in the 90s to have her shoulder replaced, and the surgeons did the wrong surgery on her and removed a bunch of those vertebrae discs from her neck that they were supposed to be doing on a different person that day. My son's obstetrician ended up being found guilty on about 40 charges of negligence causing bodily harm. Children injured during deliveries, unnecessary procedures, hysterectomy botched, etc. Found out a year after my son was born, the delivery was traumatic and went into emergency surgery for at least 5 hours while I was stuck in hallway asking what is going on. The hospital stonewalled us for info, but after the lawyer contacted us a year later we realized something had gone wrong. Son and mother are good 30 years later, doctor is practicing somewhere in UK still. A friend of a friend went to see a military doctor with chest pain and difficulty breathing after a slip and fall. Doctor insists friend is fine and is being dramatic. My friend insists that it hurts bad, and the doctor needs to take another look. Doctor continues to insist that friend is trying to get out of PT or something stupid. My friend refuses to back down. The doctor finally relents and orders an x-ray, basically sneering that friend is a slacker and that he's confident the scan won't find anything. Friend gets the x-ray, goes to the waiting room to await results. X-ray tech runs out screaming for someone to call the ER and bring him a gurney. Turns out my friend's rib had broken and punctured a lung. Grandfather in early 60s went in for a simple issue. Was about to be discharged. Something was wrong with some paperwork and the nurse gave him a large dose of penicillin which he didn't even need. My grandfather was wearing his medical alert bracelet warning medical staff that he was gravely allergic to penicillin the evening he died. My mom is a physical therapist. She had working relationships with a lot of orthopedic surgeons. One of them was a workaholic who scheduled more surgeries than he could really handle, and one time amputated the wrong leg. When I worked at a hospital, I was at one point given the job of sorting through the incident files left behind by a manager when she had been made redundant. One of them referred to what was called a never event as an event that should never happen. It was from the early 2000s, and long story short, they hadn't administered the right dosage of anesthetic, so the patient woke up and started writhing and screaming mid-operation. Also got a more minor personal experience. I was born very premature, had to have nutrient drips and whatnot. The nurse insisted that my arms were too scrawny for a drip, so they put it into my chest. The nurse placed the drip incorrectly and resulted in the liquid being fed directly into my lungs. Fortunately, the staff realized their mistake and performed a chest drain. But if left unchecked, I could have effectively drowned internally. The hospital, known locally for being incompetent, sent me home with half of my paperwork for someone else, which included prescriptions. Which means they sent someone else home with the other half of my paperwork, which included my personal information and my prescriptions. But I can see how it happened. As we all know, an 89-year-old Hispanic woman and a 39-year-old Irish man are so similar on amused face. A good family friend was home from the US, would have been his last time before getting married and moving permanently. Feeling ill for a week or so and repeatedly went to the doctors and ER only to be sent away each time without tests. He was told it was stress from being away from his partner and plans to leave home permanently. On the last visit, he was brushed off again and sent home without tests. While home, he had a brief conversation with his dad to the effect of "something's wrong, call an ambulance," and just passed away. The local family dentist when my mother, 60s, was a kid, was a known, full-blown alcoholic. Injected my mother's gum, under the tongue area, and kid you not, injection came clean out the other side of her gum. Like right through her jaw. My mother was in her 50s before ever seeing a dentist again. My wife was in PT school, and during one of her inpatient rotations she got invited to watch heart valve surgery. The doctor got all the way into this dude's chest cavity, and something didn't look right. It was the last day before a holiday weekend, so the surgeon couldn't get a hold of anyone to consult with, so they closed the guy up and had to reschedule it. It turned out they had gone in to fix the wrong side. They lied to the patient about something unexpected and out of their control for aborting the procedure. He never learned that the surgeon read the chart wrong. Never get major surgery near a holiday weekend. I know someone who suffered permanent brain damage and got a settlement because a hospital discharged them when inappropriately and they got in a car accident as a direct result. I don't have all the details because it is subject to an NDA. Oh, and a specialist I once saw turned out to be a serial sexual predator. Like dozens of victims. Patients he saw in his office. The creep. The odd thing is, when I saw him all those years ago, I totally was creeped out by him even though he didn't try to do anything inappropriate at the time. I just felt super uncomfortable. I only had to see him once, though, so I forgot all about it until I saw his face on the news. I worked for 5 years for the doctor's liability insurance company and am still in the field, just a different role. Here are some that stick out. The doctor who set a woman on fire in the OR. She had an oxygen mask on, and the anesthesiologist adjusted it right as the surgeon fired the electrocautery to remove a lump on the forehead. The oxygen spilled over her face and lit her head on fire. We settled that one because one of the nurses testified she heard the surgeon yell out, "Oh shit, not again." Because this was his second OR fire in 6 months or so. I had a third claim with the same surgeon from a guy who found a surgical towel in his abdomen 5 years after his surgery. The woman who needed a hernia repair, but her surgery was accidentally sent to the hospital as a gallbladder removal. Funny thing is she signed a bunch of forms agreeing that she needed her gallbladder out and gave consent for the surgery. Ended up having a bile leak, collapsing at work the next week, and coming back to the hospital where she said, anyone but the surgeon who removed the gallbladder. But nobody told the surgeon, so he came back in and consented to her for the bile duct repair and fixed the hernia he was supposed to do the first time. A doc wrote a lady a prescription for an anti-malarial drug that gets taken weekly. He wrote to take it daily. She had dizzy spells and an upset stomach, nothing serious, but the doctor refused to settle for a pittance because she's fine. Spent tens of thousands on attorney fees and ended up settling out of his own pocket anyway. A woman who was written a prescription for Lamictal, a powerful bipolar drug that needs to be tapered on and off, but on an accelerated taper. The patient developed Stevens-Johnson syndrome, which is blisters and sloughing skin over the entire body. Her eyelids glued themselves to her eyeballs and her eyelashes turned inwards, causing additional scarring and requiring them to be plucked. Her vagina developed internal adhesions. The bottoms of her feet shed layers of skin. Not a malpractice issue exactly, but a terrible nightmare nonetheless. A woman nicked herself shaving her pubic area and developed necrotizing fasciitis, or flesh-eating bacteria. She had one leg amputated, then the other, then both arms, and then died anyway. My job gives me nightmares, but it pays the bills. A guy I used to work out with. He hurt his wrist really bad during a lift, went to the ER where X-ray confirmed he broke it, and they decided on emergency surgery. He was trying to get as comfortable as possible, so he had his legs crossed on the gurney. None of the medical staff noticed, and he spent like 6 hours in the OR and then some more time regaining consciousness. By then he had developed compartment syndrome in his calf and had to be put in emergency surgery again. In the end, he can't lift anymore as his wrist is permanently weakened. He walks with a weird limping gait because he is missing so much of one calf. The uneven moving has ducked up his back and he is hooked on pain pills that they sometimes give him, but sometimes some doctors decides he is a junkie and just let him spend a few days in pain. I had a ruptured spinal disc last year and got treated by Austria's best doctor for spinal injuries. He told me of his accident 20 years ago where he fell something between 15 and 20 meters off a cliff. Among a number of other things, one of his spinal discs was damaged and needed surgery and the surgeon operated on the wrong, completely healthy disc. Today he can walk again, but he still has problems with his spine. I had problems with my neck for years, causing a great deal of pain which eventually began affecting my work. Unable to concentrate, couldn't remember simple things, etc. Because of my being a former football player, who also had his fair share of shots to the head off the field, I was terrified of anything being wrong with my brain. I went several times to doctors and hospitals trying to get someone to take a closer look at my head and neck, but they wouldn't do any more than x-rays. Finally, I saw a neurologist out of desperation who ordered CT scans of both my head and my neck. My brain was fine, but I had a ruptured disc in my neck that was pushing on my spinal cord and causing me so much pain I could barely function. After a series of steroid injections, and months of physical therapy, I'm back to being myself again. Unwarranted plastic surgery. That was worse than having your kidney taken. Ask any dental horror victim how they'd like it if fake teeth couldn't cover up the catastrophe. As a kid, in the town I grew up in, that one doctor that was notoriously bad, but somehow still kept his job/license. Of the people I personally know, he misdiagnosed 2 heart attacks on 2 different people as indigestion. He gave them Tums and sent them home. They died later that night in both cases. Then, another person had a constipated baby. Less than a year old. So, what was the genius doctor's idea? Manual extraction, roughly. The baby and parents were both pretty traumatized by it. Somehow the guy dodged malpractice suits. To this day, I don't really know what happened to him. But there were many stories about that guy. My father went to the doctor one Thursday in early 2009 complaining of chest pain and shortness of breath. He was not typically the type to visit the doctor unless he really felt he needed it. The doctor did absolutely nothing, no examinations were performed, and he basically told my father he would be fine. He died 2 days later. A neurosurgeon who did spinal surgery. He had a local machinist copy surgical devices, screws, etc. He used them in surgery to up his profits. He also had another surgeon sign off on procedures that were not done. This increased his profits. He was doing about 3x as many surgeries as other surgeons. He lost his license and went to jail for insurance fraud. Not to mention he was a lousy surgeon and was sued for malpractice numerous times. My wife, nurse practitioner, saw him for an issue. She said after the initial visit, I wouldn't let him touch me with a 10-foot pole. I guess he didn't impress her. She was right. Not really a horror story and probably wouldn't win a malpractice case, but about a month ago my father went to the ER complaining of leg pain. Backstory, he's on chemo for bladder cancer and had TURBT procedure done. ER docs do a venous Doppler to check for venous blood clot. Nada. They release him telling him it's just plantar fasciitis, to which I said no, it isn't because I've had that multiple times. A few weeks later, the pain only got worse. Goes to a different hospital. 30 minutes and the ER doc notices he finds NO pulse at his foot. Orders arterial Doppler. It's an arterial blood clot. Immediately admitted and transferred to a neighbor hospital for emergency surgery. Had he not gotten a second opinion and just let it go, he'd either be dead by now or his leg would have been so bad they'd have to amputate. All because nobody at the first hospital thought to check for a pulse at his foot. The sheer level of difficulty it takes to get any kind of victory or compensation for medical malpractice, even blatant medical malpractice, in Texas. Absent a surgeon leaving a foreign object inside of a body, which is strict liability, it takes, essentially, proving that doctor did it on purpose in order to get any kind of liability. And even then, after economic damages, medical bills/lost income, you cannot recover more than $250,000 in non-economic damages no matter how egregious the malpractice was or how bad of a mental or physical state it leaves the patient in. When giving birth to my oldest brother, 1969, my mother experienced difficulties resulting in a blood transfusion. The infusion given to her was carrying hepatitis, infecting her. Thankfully, she didn't pass it on to the rest of the morons she gave birth to. It did, however, damage her liver over the years, and she only had 15% function of it when she passed away. Well, mine. I have a mystery illness and they deemed it mental. One day I was sleeping and woke up to intense heart pain. I got an ambulance to the hospital and found out my heart rate jumped to 200 BPM. Then suddenly, this one nurse told nobody to help me and said, he isn't sickest mentally ill, he's faking. Suddenly my body froze up and I couldn't move. She didn't believe me. She pricked my feet with pins, pushed a catheter in me, yanked it out roughly and told all other nurses to avoid me. I cried and begged for someone to help me or stop her. I think my heart skipped or something because suddenly I passed out. I woke up to the next shift of nurses and they explained blood work was running and my potassium dropped too low to read, so they gave it to me through IV. When I left the hospital I saw my doctor and found out the hospital removed the potassium from my record. They played it off as never happening. Then I showed my dismissal papers that showed the potassium. Called the hospital to report what that nurse did. I was rude to speak to an employee and they gave me that she was wrong, but she shouldn't lose her job over one mistake. He said she was a long-time nurse at that place, and they wanted this handled without her firing. I tried to lawyer up, couldn't prove the abuse and couldn't prove they removed the potassium treatment from my record. They added it back before I got proof. To this day, I have a fear of hospitals now and refuse to be in one unless someone I know is with me. My dad went in for knee surgery. He was an alcoholic, bothered the nurses too much, and got prescribed a sleeping pill the night before surgery. Threw up in his sleep, ended up in a coma from his lungs filled with stomach fluids. 3 weeks induced coma. At the same time, his mom, my grandma, was looking at him in the ICU. Turned around and said, "Why are we here? I don't know the guy." Yes, she was in the advanced stage of Alzheimer's. Hold on to your health, guys. You never know when things go south too fast for you to react. I spent some time on ward about 20 years ago and I'll never forget what the guy in the bed across from me went through. It's not nearly as dramatic as losing the wrong leg, but it stuck with me. About 2 weeks into my stay a new patient comes in. Over the next few days we get chatting. He's about my age, has some good stories, and we share some interests. Early in the morning he woke up screaming in pain, woke the whole ward. Nurses rush in and he's screaming, tears rolling down his face, bright red, shaking the full works. After 15 minutes of intense screaming and shaking he stops. Nurses can't figure it out, but we are all ill and pain is a symptom, so maybe it's that. A couple of hours later the same thing again, and this carries on all through the day. By the evening the consultants are called in to give him a look over. Their conclusion is his condition must be getting worse, up his meds and see how he gets on. Makes no difference and screaming continues overnight until finally the surgeons are called in. He needs his bowel removed. Anyway, he rushed off to get prepped and that's it. Didn't see him again until a week later when he returned to the ward. He didn't need his bowel removed. Apparently when the nurse put his cannula in she was distracted, and he was hopped up on pain meds. The vein was missing, and the needle had pierced the bone in his wrist. His pain was so routine because whenever the pump kicked in all of the drugs he was on were going into and around the bones in his wrist. It was noticed when ICU replaced the cannula and the screaming stopped. It was alarming how quickly he went downhill and how quickly the doctors jumped from a couple of steroids to bowel removed. Less medical malpractice, just idiotic practice by medical staff. Doctors used to write lots of weird abbreviations in notes, things like tube for a really hot woman. Stood for unnecessary breast exam. Sickening, really. Used to work in healthcare during the pandemic. There was a patient that was downgraded to my unit from one of the COVID units. He was around his mid-30s and was a relatively fit guy. No previous medical conditions. When he was in the COVID unit, sometime in the beginning of his stay, he was put on a BiPAP and left there for about a little under a month. He'd never been re-evaluated to have it taken off and no respiratory therapist, nurse, or doctor had thought about it when they stuck him in the room. I have no clue how it managed to go that long, and I was so surprised he was even alive. Once it was discovered he'd never been taken off of the biped, his lungs were already shot. None of the staff had broken the news to him, and refused to tell him that he was pretty much gone. His health had seriously deteriorated. There was blood all around and inside his mouth from the pressure of the biped after so long. He couldn't eat or drink, and we couldn't even clean up all the crusty blood around his face without risking his vitals dropping. Since no one wanted to fess up to this man that he did not, in fact, have a fighting chance, he was left incredibly confused as well as his family. The stretched thin stuff definitely resulted in a lot of wrong deaths that could have been avoided, but that one still haunts me. My uncle lost his eye because of surgeons' negligence, and they tried to cover it up. My uncle had multiple eye surgery in his right eye. I would be the one with him in the hospital because I can talk to people and understand things. I had been keeping track of everything. His last surgery was done 6 months ago. They'd filled the eye with silicone and now was the time to remove the silicone. The surgeon accidentally cut the retina and stitched it back. And when I got the surgery file, they left it blank. They thought it would go unnoticed, but I went to find out why is the file blank. took the issue to the seniors and they called the surgeon, and he was humiliated in front of me. 2 months later the eye dilated and expired. Uncle decided not to press charges. At a state university medical center, a pathologist misdiagnosed at least 10, most likely at least over 30, pancreas biopsies as benign when they were malignant. Pancreatic neuroendocrine tumors, what Steve Jobs had, that have not metastasized can be treated by surgery with a 95% survival rate. With pancreatic adenocarcinoma, even without detected metastasis and surgery, the survival rates are dismal regardless. What does the university do? Cover up that the director of cytology knew about it for 6 years and did nothing. Then they hire several private investigation firms and use the good old boy system to call upon political favors from several politicians to attempt to discredit the whistleblower. But who cares about patients when protecting the finances connected with the most successful football team in the SEC and college football history? Anyone that hates the team/state for always winning championships takes solace that the people in charge care more about football than patients' lives. And yes, the whole incest with cousins thing is true. At a private hospital in the South, a pathologist was not looking at 30 to 40% of his slides and using a program to automatically dictate those cases, then proceeded to sleep 2 to 3 hours at work every day. Unknown how long it was going on for, but most likely at least 5 years. That is straight up fraud. Unknown if any patients were harmed. What does the hospital system, largest for-profit system, and the Associated Pathology Group, also based out of Nashville and part of the same good old boy system, proceed to cover it up? Maybe the medical system and society should pay more attention to what is going on in the lab. My mom was told to not have children because she could have a 50/50th chance of passing on her kidney disease, which is treatable, and here I am today against their wishes. Wish I knew who it was, but they probably aren't alive anymore, I should say, should I not exist to their face. One case in a delivery room. For some reason a mom needs forceps to help with delivery. Intern 1 was doing it, under attending staff's supervision. Something went wrong and instead of pulling out a baby, they pulled the whole uterus out. The mom passed away a couple of days later due to blood loss. One case in ED. A nurse forced a urine catheter in a male patient, his urethral ruptured by the force. The patient needs surgery and everything. This happened again in a span of 6 months in another department. One orthopedic attending staff has a bias toward patients based on their wealthiness. He will visit wealthy patients 2 times a day, every single day until D/C. But for less wealthy patients, even though the patient's condition was worse, he never visited. Only send interns or med students to visit her. Situation likes. Wealthy patients, in their 30s, broke their ankle. Another patient, in their 60s-70s, broke their hip bone and had an untreated heart condition after surgery. Yep. He never visits the second patients. Only send interns or med students to visit her. But visit the first patient every single day, 2 times a day. In person till D/C, healthcare is free in my country, since free healthcare in my country equals healthcare workers overworked, underpaid, so it's really common for patients to give healthcare workers all sorts of gifts, mostly food, money, etc., as an appreciation. Almost equivalence tips the waiter culture. But it is still completely normal if you don't give gifts, unlike no tips. As that said, some patients are wealthier than others and have an ability to provide significantly more gifts or tips. My now dead uncle's brother was pushing a car and hurt his chest. He went to Sparrow saying his chest hurt. Doctor told him he probably just pulled something. Well, my uncle's brother kept insisting there was something wrong and they wouldn't believe him and told him to go home. He died a few days later because he tore a valve in the heart. His last few moments were probably constant agony. I don't remember the specifics. My uncle isn't around to tell me it again because he committed suicide.
Thanks for watching. Please comment, like, share and subscribe. The Internet Surfer on YouTube for more horror and scary stories.